Thousands of Americans are seeking medications online to induce abortion as access to abortion services decline nationwide. New data from the Society of Family Planning estimates there were roughly 10,000 fewer legal abortions in the 2 months after the Supreme Court overturned Roe v. Wade. So far, at least 14 states have ceased nearly all legal abortion services, including prescriptions for medication-mediated abortions. ABC News national policy reporter Ann Flaherty joins me live now for more on this. And what kind of immediate impact are these laws having?
So, Diane, we're seeing, as you mentioned in this data, that there are fewer abortions, but that is legal. Those are legal and medically supervised abortions that we're talking about. We're not talking about this rise that advocates say that we're seeing, which is in what we call self-managed abortions, typically through abortion medication that these women are purchasing online. So mifepristone is a pill that it's been legal in the United States for 22 years now, but the FDA has rules around it, and many states ban it. So what's happening, they say, is that these women are turning to online sites, they're buying it from overseas pharmacies, and they're taking it in the privacy of their own homes.
Now, abortion rights advocates say that the demand for abortion pills has exploded, even in states where abortions are still accessible. Why is that?
So that's, one of the interesting fallouts of this post-Roe landscape is that you have so many restrictions, even in states where abortion is still legal, that many women say that they don't want to jump through those hoops. I've interviewed some women who say, when you're talking about mandated ultrasounds, when you're talking about waiting periods, that can really be detrimental. And if they know that they want that abortion and they want that care now, they don't want to wait. And with these online sites, they don't necessarily have to. Of course, the FDA says this is potentially dangerous, and they're warning Americans not to order online medications from pharmacies that are not regulated by their agency.
And Ann, I know you've been speaking with women who say that they're still finding ways to abort their unwanted pregnancies. What have they told you?
So, I've interviewed one woman who was living in New Mexico. This was another example of where abortion was legal. It was accessible. She told me that she felt like it was more legally risky to go to a clinic because she didn't know of the changing landscape. She didn't want to show up and be told suddenly no, that the law had changed and that she couldn't get the abortion that she wanted. The other concern that she had was that there would be mandated waiting periods or ultrasounds that would require multiple trips to the clinic. She had already purchased abortion medication online from one of these online overseas pharmacies, and she had it waiting for her in her closet. Another woman I spoke to did travel. She was 6 weeks pregnant when she knew that she wanted an abortion. She traveled out of state because she was living in Texas at the time, and she wasn't able to get the abortion until 15 weeks along. She said that waiting period for her was traumatic, and the wait was agonizing. So really, this demand for abortion pills, that demand is being met by these online pill brokers.
And meanwhile, services selling medications online, they're expanding operations to fill demand and buy generic versions of these drugs in bulk. How does that work, and is it legal?
So it's not legal. It's outside of the scope of the U.S. regulatory system, for sure. And as I mentioned, the FDA does urge people not to buy their medications from overseas. But, much as Americans have gone across the border to Canada to get insulin, for example, or they go to India to get more affordable medical care, we are seeing Americans turning to these online sites to buy this medication. So I spoke with one person who said most of it's coming from India. You can purchase it for about $15 a kit. And then what these online pill brokers are doing are then turning around and selling it for about $150 to $200. So that's a significant profit for them.
All right, Ann Flaherty, we appreciate it as always. Thank you.
Thanks, Diane.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.